Hi, everyone. Today is March 3rd, 2021. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and Emergency Medicine Physician with Dartmouth-Hitchcock Health. And this is Medical Matters Weekly, a show about aspects of healthcare that matter to you most. You can submit your questions on Facebook Live, and we already have some questions that have been coming in. And the title of our show today is Getting to Herd Immunity. My guests are pharmacist Rob Sherman and Emilee Bonnier. And Rob is the Director of Pharmacy Services at Southwestern Vermont Medical Center. Welcome. We're excited to have you. He received his bachelor's and doctorate in pharmacy from the University of Connecticut. And you have worked at SVMC for a few years, since 1989. Is that right, Rob?
That is correct, Trey. Thank you for having us today.
Yeah.
I am a long employee here. I started out in engineering in 1989, mowing the grass.
That is great. So you went from mowing the grass to mixing the medicines for our community, which is fantastic. And you've been the department director since 2015, I believe?
That's correct. Yeah, thereabouts. 2014, 2015 was when I transitioned out of my clinical coordinator role or clinical specialist over to the directorship.
And that wasn't enough, so you did a residency in infectious disease.
Correct, I did. I studied at Hartford Hospital. And I did that, following my doctor of pharmacy. And just recently, I finished my master's in healthcare administration.
Yeah, that's great, by the way. Congratulations. Real quick, what does a pharmacist who does a fellowship in infectious disease do? What kind of expertise does that give you?
So we're, very much a part of the healthcare team. We practice alongside of the infectious disease, fellows, students, or residents, and house docs. I was fortunate enough to get accepted into a PGY1 in a infectious disease rotation at Hartford Hospital, and the residency served me well. And I came back here and worked alongside of Dr. George.
That's great.
Which worked out well.
Do you still mow the grass any?
Only at my house.
Okay. All right. And Emilee is a pharmacy clinical coordinator and clinical pharmacist at SVMC, and we're so psyched to have you, Emilee.
Thank you for having me.
So just real quick, before I get into your background, where are you right now? Like, what is that behind you?
So I'm actually in the picking station in the pharmacy, where all of the unit dose medications are that our technicians work to pick things for the fills up on the inpatient units. That's
really cool. That's a lot of little boxes back there or category things. So you received your bachelor's in pharmaceutical sciences and your doctorate of pharmacy. So you are a doctor of pharmacy from Albany College, correct?
Correct.
That's awesome. And you've been with SVMC for a number of years, since 2017?
Yep.
That's great. All right, so I'll start with you, Emilee. Just, what we're going to do is spend a little bit to get to know you, understand what pharmacy is about, and being a pharmacist is about, and then we're going to go into some of the aspects of COVID and the pandemic, and then we'll sort of wrap up talking about some of the differences and all the vaccine choices that are out there. So, Emilee, where did you grow up?
So I grew up in Troy, New York. I have mom and a dad, and then a younger sister.
Great. And then did you go right into pharmacy?
So no, I initially didn't want to be a pharmacist at all. So I'm actually a fourth generation pharmacist. Oh, so wow. My family owns an independent pharmacy down in Troy, New York, named Lindsay Drug Company. My great grandfather started it, and I didn't want anything to do with pharmacy coming out of high school. So sure. I went and got my bachelor's in pharmaceutical sciences, where I wanted to do research. And then I was looking for an advanced degree and decided to go back for pharmacy and to get my PharmD.
That's awesome. So at PharmD, just tell me a little bit about that real quick. So you're a doctor in pharmacy, is that right?
Correct. So the degree program is a little bit longer than the bachelor's program. So they've actually changed it to a doctorate program, which includes a bunch of advanced practice experiences. So pretty much you work for a year in different settings, trying out different pharmacy locations and services, and you decide where you would like to work and where you would like to be.
Okay. And so I'm going to move a little bit and say, when you're not talking about pharmacy and doing pharmacy, where do you live? You live here in Bennington?
I actually live right over the border in Pittstown, New York.
Okay. And what does a typical pharmacist do when they're not doing pharmacy? What kind of recreational activities do you pursue?
Typical pharmacist. Well, so I teach yoga twice a week. I enjoy hiking, and my father in his retirement actually owns a bicycle shop. So I help him with that. So I like road biking, mountain biking, that type of thing. But so we stay busy. I stay busy when I'm not at the pharmacy.
Yeah. Well, maybe you're not a typical pharmacist. I don't know. I'll ask Rob. Rob, what do you do when you're not being the director of pharmacy?
So, like Trey, I'm I'm a local Vermonter, and like many other Vermonters, I really enjoy the four seasons here, and I spend a lot of my time outside hiking, biking. This time of year, making sugar, making maple syrup. We're tapping and doing the sugaring.
So you're a typical Vermont pharmacist, maybe is the way to think about that. So, when I think about being a pharmacist and what you do as a pharmacist, it's a pretty exact sort of scientific, methodical profession. Are you that way in your personal life too, Rob? Is your house like extremely neat and measured out?
So, for me, more so on some things and not on others, but my family would tell you I'm probably a lot more attention to detail than I like to admit. Things are very laid out. They have a, particular place, and that's my lifestyle. And it can bug my family from time to time.
What does your wife do?
So my wife actually works here at the hospital. She's a 340B analyst, and she works in the pharmacy field as well.
Right. So you both must have a really meticulous house. At least that's what I think of it when I go through it.
14-year-old and my dog takes care of that, Trey.
That's great. So for both of you, I'll start with you, Rob. The past year, of course, for everyone in any field has changed what they do from a day-to-day, and particularly in healthcare. How has this past year affected you and your workforce, your colleagues, and anything you want to talk about even your day-to-day operations?
Yeah, so the pandemic has been a challenging time for all of us, and pharmacy's been touched in many ways. We first looked at shifting our workforce from inpatient care to outpatient services for medical inventory, to now we have a pandemic and sick patient population is coming in that we've only read about in textbooks and studied and drilled and prepared for, that we really didn't know what to expect. So our workforce, our day, or our structure for our day really changed here at the hospital. We were going from, thinking about caring for more critically ill patients than what we have seen in the past. And it's even evolved to this day. I mean, now we're running, helping run the clinic at SBC, and pharmacists are up there, drawing up vaccine and mixing and being very much a part of the team, and, helping getting that shot to the patient, and one dose at a time, trying to make a difference.
That's great. Did you rehearse that? Because that's just an excellent answer.
No.
Emilee, what about you? How has it changed your role? And I just want to point out, and that Emilee has taken on some more leadership in the system and at SVMC. And so first off, we appreciate that. Thank you. But how has the pandemic changed your day-to-day?
I think that it has helped me better use like my quick thinking skills and problem solving, and really like thinking on your feet and being able to come up with solutions in less than a day for things that are, being brought to the forefront that you thought you would have more time to figure out. And obviously with the constantly changing just medication scheme, we have to be prepared all the time and be willing to, work within the day to get some sort of process or procedure to get things done so that we can, provide patients with the appropriate care.
Have you guys seen, do you use more medicines right now during COVID, or are the doctors requesting more medicines, or is it about the same? And I'm not talking about vaccine, just, for the public, they very much support the system and the nurses and all of us, and they see that our volumes have risen at times. Are you seeing more requests for medicines or not really?
So I can jump in there and start off, Trey. I think we're seeing about the same amount of requests. It's just the medication may be used in a different way. We're now seeing meds that were used for rheumatoid arthritis that are now being considered for COVID patients or used in a different manner than what we're used to. We're definitely challenged with some of our outpatient services we're offering around monoclonal antibodies, and we're seeing, again, that sicker patient population in our intensive care unit. So we are seeing a little bit of a bump there, but overall, not a huge change.
Let's talk about some of those medicines, Rob. Why don't we just start with some of the inpatient medicines like remdesivir and how SVMC has acquired that drug?
Yeah, so the remdesivir is on. It's officially available through Vaccination is a trade name, so we can now order it more in a direct approach versus going to the state Department of Health to get the remdesivir. But typically, we see that our patients are in need of the medication over a period of anywhere between 3 and 5 days. Standard therapy is for a total duration of 5 days. And then we would reassess the patient and see if we needed to extend dosing beyond that. But we're doing weekly inventory, weekly counts, and working closely with the medical staff. Dr. Marie George is, one of the consulted providers that would authorize use, and we work to make sure we have an appropriate stock here at Southwestern Vermont Medical Center.
So that's a medicine you're using for patients that are hospitalized with COVID-19. Do they all get that drug?
No, not all of our patients are getting it. I mean, it's based on a bunch of criteria, and we got a checklist that we go through. And if the patient is sick enough and requires the medication, certainly it's available. And we do see a fair number of patients on it at any one given time throughout the week, but not all COVID patients are requiring remdesivir when hospitalized.
Well, I want to point out that due to both of your work and that of Marie George and others in our system, SVMC has access to most any approved and accepted medication for COVID-19. And so thank you all for your hard work in making sure we get that. Let's talk about the outpatient drug, though, the monoclonal antibody and how that's being used. Let me ask Emily first off.
So it's a similar, so it's a criteria process. We have a checklist and a process that we have to follow for the bamlanivimab, the monoclonal antibody that's used on the outpatient side. So obviously, once a patient meets criteria, we do have access. It is something that is being compounded and administered in the hospital. So we have to make sure we have appropriate beds and appropriate staff to be able to do that. So it's really been a process where it has included all departments, pharmacy, nursing, and just to make sure that we have it for the patients that need it or meet, the qualifications for it.
That's great. And, some of those qualifications for those in the audience here who are listening is if you do get COVID-19 and you're getting pretty ill, but not sick enough to be in the hospital, and you meet certain criteria, which is a long list that has to do with things like when did your symptoms start and what are your underlying diseases that accompany the COVID-19. Regardless of if you meet all of those things, you can come into the hospital by doctor's order and we give you this infusion. Is it generally over an hour, the medicine?
An hour and then an hour for monitoring. That's why it needs to be administered here where they can be watched.
Right. So they hook you up to an IV. Emily prepares the drug. Well, we give it to you, then we watch you for another hour. And then, the results have been pretty good for those who are moderately sick, but not sick enough to be in the hospital. And that's a different treatment if you do get in the hospital, because then the drug's efficacy is not as good. So we have to look at other types of drugs. And that's the one that Rob was talking about there. Rob, what is that behind you? It looks like a glowing R2-D2.
So that is our COVID refrigeration storage unit right now. So behind me on the top shelf, you're probably getting a glimpse of Moderna. We currently have our vaccine thought out for the community clinics. As you know, we're in the age banding of the 65 plus, and we're going through a fair amount of the Moderna vaccine throughout the week. So we move it from the freezer back here, and this is where it's currently located until we go to SVC with it.
Is it in a secret closet? Are you in a secret closet with a big padlock on it?
No, I'm up in our mezzanine in the back of the pharmacy loft area. So we're in the back storage room.
I have to tell you all, I went and vaccinated a homebound couple last week, and as I was just carrying the medicine, to my car, in my vehicle, and driving there, I just kept thinking, what if I drop it? You know, what if I do something with this? And I'm sure you both experienced that early when you were working with the vaccine, because it is so remarkable. It seems priceless, and we want to keep it. So that fridge back there, that freezer, so you have Moderna there. Is that the ultra cold freezer?
No, this is once we unthaw everything. This is a refrigeration stored between 2 and 8 degrees Celsius, or 36 to 46 degrees Fahrenheit. And it would stay here for up to 30 days under refrigeration. We also store Pfizer here once we remove it from the ultra cold storage, but those are much cooler freezers.
Right. So it's the Pfizer is the vaccine that we all heard about early on that requires that super, super cold temperature, which is remarkable. SVMC, through Rob's leadership, acquired 2 of those freezers, right? Put the order in back in May, I believe, or April.
Yeah, April, May. Yep, right around that timeline. Yep.
And they showed up just in time, maybe November or so, for us to be ready to hold that Pfizer. So there's only about 5 to 7 in the state, at least the last time I checked, and SVMC is one of those, allowing us to store that Pfizer. Of course, if you follow the media, you know that there's been some adjustments to that storage requirement, allowing it to be in a less cold environment for a longer period of time, which is certainly welcome in our ability to vaccinate the population. And we're doing pretty well. We've got about 19 to 20% of the state vaccinated so far. And if we look at those over 75, it's nearly 80%. 80% of people above 75 in Vermont have at least received their first shot of vaccine, which is an incredible feat. Of course, those are the folks that are at most risk of hospitalization and death. And that is the reason why we started with that group to begin with. So my understanding is that the vaccination clinic is up at Southern Vermont College. It's more than my understanding, but as I interview, I will say it that way. Are you up there every day, Rob and Emily?
Almost.
So, yeah, Emily, you can step in and
Yep. So I'm running most of the process up there, and the troubleshooting, and obviously relaying back to Rob. He's stepping in where he can, but no, I'm up there. Today we had a very large day, about 350 vaccines. So
wow.
We're starting to push the volume, which is wonderful. And it's definitely very different than, any vaccine process that I've ever been through myself before.
And take us through that real quick. So you're up there, you get into the gym at whatever time, 6 or 7 in the morning. And what do you do?
So it's a very team-based approach. We usually have some sort of huddle in the morning, but pharmacies primarily works with preparing the vaccine. So we're just drawing up vaccine doses, whether it's Pfizer or Moderna, based on numbers and counts that we're preparing the day before. And with a beyond use date of only 6 hours of the vaccine being in the syringe, we have to play with numbers to make sure that we are using all vaccine, because still to this date, I believe we have not wasted any vaccine, and we are being able to administer any last or extra doses to the community and to the populations. And that's the reason we have to be so concerned about that, is just because of the odd numbers, or the numbers of doses that we can pull from every vaccine compared to the number of appointments that are being allowed through the state.
Right. I'm so glad you brought that up, Emily, and just want to say that again to emphasize it to the community. From the very beginning, we anticipated what people have termed extra doses at the end of the day. We have a process where we get those doses to people that are in the right age band, and we make sure, and we have not wasted any vaccine. It has always gone into people's arms. We're well above 90% in the state, but also down here locally at getting vaccine into people once we receive it within the defined timeline. And that's just wonderful. And I don't say that boasting about our process, but maybe I will a little bit. But also by doing that, I'm boasting about Rob and Emily, and then all the other many people who have made this work, made it successful, and we've got many months ahead of us, and we're moving forward. We can actually talk about that timeline in a minute, but I kind of want to get into some specifics on the vaccines because people can read about the timeline. So if we have time, I'll get to that. But let's just talk about how many vaccines do we have available now? Rob, I'll put that question to you.
Currently, Trey, here at Southwestern Vermont Medical Center, we're on vaccines. We have Moderna and Pfizer, and as many of us know or have heard through the news stations, Johnson & Johnson recently received approval for emergency use authorization, which I'm hoping will bring a third vaccine to us soon.
That's right. Yeah, it kind of went out there, but you said we have two right now, the Moderna and Pfizer, and then Johnson & Johnson, which people are looking forward to. Can you just tell us, Rob, real quick, what are some basic differences in those three vaccines, just that the public would want to know about?
Yeah, so with Pfizer, it's, Pfizer and Moderna, they're both mRNA vaccines or messenger RNA vaccines, and they're both two-shot vaccines. Pfizer's given 21 days apart, first dose, then 21 days later, you would get that second dose. Moderna, again, a messenger RNA vaccine that you administer your first dose, and then 28 days later, you follow up for the second dose. Johnson & Johnson's the new vaccine that we're, going to be looking at as a one-time dose only. That's in a ready-to-administer form. It's different than Moderna and Pfizer. It's developed through a DNA process, and they use a different sort of adenovirus to deliver the messenger script into our cells to help us develop our immune response when we do come in contact with the COVID virus.
That's great. And so what we learned from the governor's press conference yesterday is that Johnson & Johnson will be available for a select group initially, and that are teachers and educators that will be able to receive that vaccine that we're going to be giving here at SVMC at the SBC site, at the Southern Vermont College site. The teachers will be able to sign up online for that. The exact details are still being determined, and we should hear more about that on Friday. But we do know that we will have at least 3 clinics here, probably on Saturdays, to vaccinate that group, which will be ready to begin on March 8th, probably with our first clinic here being either that weekend or the following weekend. But they will know that because they will be able to sign up. They can also sign up at Walgreens and receive Moderna or Pfizer in that way. And then eventually the supply of Johnson & Johnson will be sufficient that it can go to others and those that want it. There is that huge advantage Rob talked about, and that is a one-time shot. Rob, can you just mention a little bit real quick about the difference in efficacy and what that might mean from the trials and what people want to know? And then I can chime in with some of the stuff we've been talking about here locally as well.
Yeah, certainly, Trey. I can give a real high-level overview on what I know about the trial data. I mean, you're looking at 75 to 85%, effectiveness out of the Johnson & Johnson vaccine, with 94, 95% with Pfizer, Moderna for efficacy. In my opinion, by looking through all of that, it's very hard to do a head-to-head comparison because all 3 vaccines were studied at different times with different variants that are circulating out there. So I tend to look at more of the effectiveness of the vaccine. And if we look at all 3 of the vaccines, the effectiveness is, 100% effective at keeping, patients away from severe illness and out of the hospitals. And that's, sort of how I look at it, when we look at effectiveness and, the vaccine choices that are available to us.
Yeah, absolutely. And I think those endpoints are really important. If we know that all 3 of them, and then actually the 4th one that if we have time, we'll talk about, that'll be coming out soon, we believe, Novavax, which is even a different type of vaccine. And the preliminary data shows a very similar performance. It looks like these vaccines all will protect people from hospitalization, protect them from death, and not just sort of, it protects them nearly 100%. And that's why death rates are plummeting once people are vaccinated. In fact, in Israel, where 90% of those above 65 have been vaccinated, the death rate is falling to what appears to be near zero in that age group, which is just remarkable. Emilee, what would you say to people who are questioning whether or not to get vaccinated? How do you explain that to your friends and your family?
I always start that off is that it is ultimately their decision, right? But that I recommend getting vaccinated. Mm-hmm. And the reason why I recommend getting vaccinated is that they're all safe and effective. And, you getting vaccinated down the road could end up helping a more vulnerable person, either not get the disease at all because of herd immunity or, not risk the spread of it. So I think in a way you're protecting yourself, but you're also protecting other members of your community. And like Rob said before, all three vaccines are showing that they limit severe disease and hospitalization. So what the choice of which one to get, I think just get one, get the vaccine, get whatever vaccine is available to you based on your criteria, based on whatever group you fall in, because getting as many people vaccinated is ultimately the end goal.
That's right. That's great. There are some people too that for very few percentage of people, very few, but they are maybe allergic to one of the vaccines. In particular, there are rare instances of people being allergic to something called propylethylene glycol, and that's an ingredient that's in Miralax and some other medications. And so that is an ingredient in both Moderna and Pfizer, and therefore Johnson & Johnson is a great alternative for that group. And I know we did get a question on Facebook wanting to know when will it be available to that group. If you truly have that allergy, if you contact me through the website, I'll work with Rob and Emilee, and we should be able to get you the Johnson & Johnson vaccine. It may not be next week as soon as it's available, but it would be shortly there afterwards. We do know that the vaccine supply is increasing at a faster rate than was anticipated just a few months ago. And so we do believe that any Vermonter will have access to the vaccine by, there's a lot of reports now saying May, but let's just stick to July 1st because that was our original plan, and we think that's achievable. Just as we're wrapping up here, because we're approaching 30 minutes, I want to make sure to catch a few questions from Facebook here, and one that was sent out earlier. This is about gathering. So this kind of going to shift and say, what are the restrictions? What are restrictions for travel, and how does vaccination affect that? So I think most people watching this know that the Department of Health and the governor did remove the requirement for quarantine if you travel outside of the state, if you are fully vaccinated. And by fully vaccinated means you've received all of the shots in the series, which could be 2 for Moderna and Pfizer and 1 for Johnson & Johnson, and then 14 days has elapsed for you to develop that immunity. But the question is, it actually says that in the banner, we mentioned that fully vaccinated households may gather together, but yet the governor reported that it can only be 2 families, and it was a little confusing because one needs to be fully vaccinated and one can be partially vaccinated, and it is difficult. So I would say that we try to follow the governor's orders and the restrictions in place, and that would be to just stay with one household that has been vaccinated. I will say that pretty quickly over each week, these restrictions will probably be lessened as long as we keep up a good vaccination rate. Of course, the CDC is warning not to remove restrictions and mitigation measures too quickly, and we will not do that in Vermont as opposed to what some other states are doing. But at the same time, as we're now at 20% of the state vaccinated, when we get to 30% and 40%, we certainly should and want to reduce some of those restrictions, including the gathering aspect. Let me just ask Rob a quick question. Does it matter which arm you get vaccinated in, your dominant arm or your non-dominant arm? I get asked that all the time.
It's funny, Emily and I were talking about this before we got on, and I know Emily and I probably differ. I take it in my non-dominant arm, only because I like to work the muscle when I can and work out the pains. But I know Emily was saying that she likes to take it in her dominant arm because moving that arm around and working that muscle helps lessen everything.
Sure. Well, it does create a little bit of a sore arm. I think many people have seen that. The same thing can happen with the flu and other vaccines, but it's just last a couple of days and then you move on. And it certainly didn't limit my activity. Emily, did it limit any of your yoga teaching?
No. I definitely could feel it in the class that I taught the night after my vaccine, but it's just soreness, just normal soreness.
Well, I'd like to thank everyone for joining us on Medical Matters Weekly today, and thank our guest in particular, Rob Sherman and Emilee Bonnier, and then also Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Health Center, Ashley Jowett from Southwestern Vermont Healthcare. I'm Trey Dobson. Go out and find joy in everything you do, even in the face of adversity, and we'll see you next week.